Hello, my name is Dr. Marble. The question that came in was, I'm having inflammation in my feet and I've tried everything. What can I do? Or what is the problem, I guess, was the actual question. So obviously that's got a lot of ramifications, that question. There's lots of things that can contribute to inflammation in the feet. What we do is we address some of the very common ones, but I would tell you that one of the very uncommon things that we then end up progressing to, but is a very real factor in inflammation that we don't, because it's not something that we counsel patients a lot with, and I'm referring to our nutrition. And it's a very personal thing. It's what can we afford, and what's convenient, and where can we go to get something that is anti-inflammatory or non-inflammatory even. And the reason why this is important is because inflammation has become more kind of a hot topic in the world today, and especially how it relates with our food supply. There are absolutely inflammatory things that we eat every day, every meal sometimes. And a couple of those things, I'm just bringing up two, is sugar. Sugar is highly inflammatory. And if you look on the back of the labels of everything at the store, even ketchup nowadays has sugar in it. It's ketchup, so why should it need sugar? Everything tastes better with sugar, right? So unfortunately though, it's inflammatory. Another thing that's very inflammatory is gluten. And I'm not just referring to patients that have celiac disease or are gluten intolerant, but I'm referring to just gluten in general. Our bodies, they just don't know what to do or how to break that down. And a lot of it has to do with the yeast component and how things changed when we went to a more industrialized yeast many years ago. And so this is something that I'd recommend doing your own research with, but as a doctor, as a podiatrist, I see inflammation in the feet. And certainly I can address some things with Band-Aids like injections or physical therapy. I can address it with laser therapy. We can take pressure off areas of inflammation by changing shoe gear or adjusting an insert. Just talking about the ground reactive forces that can occur in conjunction with a high BMI as your body mass index, as you're walking around, that absolutely can contribute to inflammation. All the surfaces that we walk in are inflammatory, right? Who doesn't go to a Walmart or Walgreens nowadays? What do you do when you go there? You're walking on concrete. And so all of those things too absolutely are inflammatory. I wanted to talk today about this other kind of zebra that many of my patients, when they're desperate, we get to that point in the conversation. And we've tried all those other things. What is happening with your diet? So hope this is helpful. I would recommend subscribing to our channel. We love to hear from you as far as comments and what your experience has been with diet and inflammation. Thanks for joining us.